record this. We can get started. So hopefully everybody had a good weekend, even though it was rainy probably everywhere throughout the states, unfortunately. So I just have a few announcements that I think most of you already know, but just a reminder that the motivational interviewing training is May 18th, so that's coming up. And if you haven't RSVP'd, go ahead and get your RSVPs into Catherine. And then we'll take a look at those, and if there are any extra spots for child health, which it's looking like there are, okay. So we'll make sure to try to get your child health staff in there too. And then the consortium is May 31st, and we have a save the date with location information that I don't think has been sent out yet, but I'll make sure that that gets out with today's follow-up information so that you know where you're going, but it is in Des Moines, as it usually is. So we'll get that sent out, and I think that's it as far as general announcements go. But we'll open it up to questions at the end to see if anybody else has anything. So today we're going to talk about TAV. Can you guys see my screen, the TAV Connect screen? See, it looks like, okay. Just wanted to make sure. So I'm just going to go over a few of the most frequently asked questions over the last month, and I may miss a few. I may not have gotten to everything, but Michelle and I have discussed most of these. So number one, I just want to talk about some changes that were made, I believe, last Thursday. So in case you haven't been in there since Thursday, we removed the introduction call from the bundle. And we did that because it just didn't really make sense to have it separated out from any other type of call, or especially if you were doing care coordination on that first call. We just wanted to make it simple so that you would just go right in and document care coordination and not necessarily have to document a separate introduction call. So that is no longer part of the activity bundle. And I'm not even sure if it's an activity that you can still add. So that was one update that we made. And then we also, based on some really good feedback that we received from most of you, added care coordination developmental under care coordination as type of service. So I think that actually automatically comes up as the option, but you can change it to dental or medical if you need to. But it seems like most of the time you will be doing developmental care coordination unless you are working with a fee-for-service client or providing dental services, and then in those cases you would select dental or medical. Any questions before I move on? Okay. So while we're looking at the bundle, we wanted to ask you guys, we've kind of had some different feedback on the send letter activity. And so I guess we can take a vote, or you can let me know now or later after you think about it, if you guys think that the send letter activity is helpful in the bundle, or if it should just be a separate activity that you add if needed. One way I guess I think about TAV is there's like the kind of like the task list side of it and then the data collection side of it. So the send letter activity would be more of like a task list item, but some have said it's helpful for it to be in the bundle because if you have like new staff taking over a client that was previously served by somebody else, or if the site coordinator wanted to go in and kind of get a summary of everything, it was really easy to just go to that send letter function and see that brief overview of what happened. So I guess think about what you want to do there. If anybody has thoughts, feel free to speak up now.
Okay. Hey, Rebecca, can you repeat that last piece?
Yeah, are you having trouble hearing me?
No, we're just trying to comprehend it all. So just phrase what you said again.
Sure. So we have send a letter right now in the first 5 bundle, and we were thinking of removing it and just having it as an activity that you could add optionally. It seems like most sites so far like it as part of the bundle, but it also might just be an extra thing that you guys aren't using and that you're constantly deleting out. So I guess I just wanted to know feedback from everybody if you wanted to keep it there or if you preferred it to be a separate activity that you could add if needed. Does that make sense?
Hi everyone, this is Jenny. Sorry, Rebecca.
Go ahead.
This is Jenny from Family Inc. I feel like it makes sense for long term so that we can train new staff if we need it, and so that it's cohesive across programs so that we know that it's actually getting sent. And it is nice as a site coordinator, if I'm not always doing the care coordination stuff, to go in and be able to see what was actually done.
Okay. Yeah, I think that seems like what everybody else has been saying too. And it looks like in the chat, everyone's liking it or doesn't have a preference. So far, I think we'll keep it in there. But feel free to send in any other feedback. And actually, one thing I forgot to mention, when we were talking about under care coordination, the type of service, if you are working with a fee for service eligible client, and you do send that letter, that would still be billable. So you would enter that as care coordination medical and then bill for it that way. Although I'm not sure if the billing piece has been set up yet. I think that's still to come, but we'll have to update you on the next call on that. But just know that you may have a different way of documenting letters for fee-for-service clients. Okay. Just taking a look at my notes. So with siblings, we've had some questions there. We just want to make sure that you are documenting siblings separately. So let's say first 5 child gets referred into the program, and then you find out that child's brother also has needs, but they weren't referred by the provider. You would document that siblings care coordination separately, but then I think best practices would be to put in the care coordination notes that Billy's brother also became part of the first 5 program, just so that we can kind of keep a handle on how that sibling was referred in. We also heard that some of the medical practices are popping up with first 5 before the title of the practice. So let's say, for instance, like Mercy Peds Des Moines is in there listed as a practice, but then it's also listed as first 5 Mercy Peds Des Moines. We're looking at deleting out any practices that say first 5 before them. So as you move forward, just select the regular name of the practice, not the name of the practice with first 5 before it. I think that it migrated kind of funky, so we plan to remove any practice that has first 5 before it. Another question we've had is there have been a few transfer issues still, and for now, let us know if that's still happening, if you're finding clients in child health and not in first 5, or if the wrong referral date is in there or anything else that seems incorrect. Let us know, but just kind of continue to update those clients as you go. So as you work with them and notice that there's still somebody in child health tab, but they should be in with first 5, just kind of bring them over to first 5 as you work with them. Just taking a look at my notes. Any questions so far? So one thing we've had a lot of questions on is when to use the call activity. I can't remember the actual name of it, but it's, when you make a phone call. And so we would prefer if you used that activity anytime there's an unsuccessful call. And then anytime there's a successful call with the family, you'll document that as care coordination. So anytime you're not reaching a family, then document that as unsuccessful, and then you can schedule another call. And then that way we'll be able to track number of attempted calls. And then any successful calls will just be in care coordination, and we'll know those are successful calls because you documented that as care coordination. Does that make sense? I know that's been a big question for quite a few of you.
Hey, Rebecca, I have Megan here with me, and she has a question. She's gonna ask for clarification.
Okay.
So previously for the unsuccessful calls, we've been using care coordination and then just noting that it was unsuccessful. So you now want us to use activity, outgoing call, and then where it has the option to do successful or unsuccessful, do you want us to still mark it as successful because we completed the call, or unsuccessful and then reschedule and put the option that voicemail left or unable to leave voicemail?
So yeah, it would be unsuccessful. And I know this is different guidance than we gave last time. I apologize for that. Some of these answers will probably kind of evolve over time, but when we really sat down and thought about it, it just made more sense to document unsuccessful calls separately. So yeah, under that phone call activity, you would document your unsuccessful phone calls there. And then, like you said, make the proper selections. Does that make sense?
Okay.
And you don't have to go back and change documentation, because I know that we've given you kind of various guidance throughout the past month. So moving forward, we're gonna try to do it this way. And actually, on that note, we are gonna work on updating the user manual. And we're hoping to kind of give more guidance as to what sort of documentation we're looking for, because right now it's kind of tells you how to do things generally. But we hope to, as we move forward in the next month or so, make things more specific so that it's not so confusing. So a lot of the guidance we're giving today will be in that user manual, or maybe even a separate manual. We haven't really talked about it yet, but we will meet on that this week and kind of make some decisions there too. So that way we have standard documentation across First 5.
That will be helpful.
I have a clarification question, Rebecca.
Yep.
I thought the TAV staff told us not to document things, at least in child health and maternal health, as unsuccessful, because you can't pull a report on an unsuccessful thing. The logic of the TAV system doesn't allow you to do that since it's binary. They can only pull reports on successful events or activities.
We can check into that.
Okay.
Trying to think, because we would just want a report that told us how many unsuccessful calls. So if we can't do that, then yeah, we may have to change. We would still want the guidance that you're going to document phone calls in that separate activity. But if that's the case, we'll have to maybe revisit this again and change our guidance. But for now, let's go with unsuccessful. And if we hear otherwise at the state level, we will let you guys know. And that's helpful to know. So thank you.
Thank you.
Okay, I'm just looking over my notes to see if I've left anything out. I did get a question on Friday if we can add barriers for specific developmental concerns besides speech. So examples: gross motor, fine motor, personal social, etc. We can look into that. We haven't looked into that yet, but TAV is really good at adapting and making changes as we've asked. So I think that that's something we can at least look into. See, it looks like there's a question in the chat. So text message is only available in the care coordination activity when we send a text message to the family and attempt to contact. Do we want it documented under follow-up call with a note that text message was sent? That's a good question. I think, yeah, we'll continue to go with follow-up call, and we can look to see if we can add text message in that phone call activity. So I'll write that down right now. I think that somewhere along the lines, folks had heard to add a barrier with every care coordination activity, and that's not something that we've heard or any guidance that we've given. So we really just want you to add the barriers as they come, but don't feel like you have to add artificial barriers or the same barrier multiple times every time you enter care coordination.
Rebecca, that's in the user manual.
On page 17.
On
Okay.
page 17.
Okay, so that's an update
And
that
then-
we will make.
Okay, and then when our super users trained first 5 staff, that's how they were trained. So then that's just kind of how it funneled
Okay.
down to us as well.
Hey, this is Megan with Webster County. I have a question, and maybe you've covered it and I missed it.
Yep.
So I've put a handful into tab now, and I know for like the MC or another programming, they're sending it on and kind of having like whoever's overseeing it, so like your equal, review a chart and let us know if it looks adequate. Is that something that you could do if I picked 1 or 2 to review
Yeah,
and
I
gave
see
you like
what
the
you're
case
saying,
number?
to have Michelle and I kind of review some of the documentation that you guys are doing and then give you feedback on how it's going? Is that what-
Yeah.
Yeah, I didn't know Child Health was doing that. That's interesting. We can follow up with Child Health and see what they're doing and kind of see how we could make that happen. So we can
Yeah.
definitely look into that.
Yeah, that would be great. I think it might just be our site specific to us. I'm not quite sure. It just it was an idea, and I thought, well, it would be nice. So
Yeah. Okay. Yeah.
Okay.
Thanks for letting us know.
yeah, thank you.
And then back to the last thing, we will definitely look in the user manual and look at page 17 on that barrier comment and make sure that that gets taken out. So sorry that that has been confusing. Okay, I'm just going to dig through my pile and see if there's anything that I have. I'm sure there are things I haven't covered, but anything that I haven't covered that I've at least looked at. Okay, here's a couple things. So I guess community event is an activity. So a question was asked, when would we use the community event activity? So within First 5, we're not asking you to use that at all. We're still asking you to document that stuff in your time studies. I don't think it was added for First 5. I did ask April, and she felt that there was nothing specific to First 5, so there was really no reason that that community event activity is in there for First 5. So just keep continuing to keep your time studies and enter any sort of community events you're doing that way. And then another April question that we asked was, when will TAV migrate the service addendums from CARES? And that is to come in the next couple of weeks, according to April. Not sure. I think that's everything I have. So I can open it up to more questions from you guys. We can't promise to get them answered today, but we will get them written down at least. So does anybody else have anything else they wanted to add? Is it going okay so far? Do you guys like TAV? Do you feel like you'll get used to it over time? Any sort of feedback there?
I think it's fairly easy. I like it how it breaks out compared to, we're already using a similar program up here. And so I like the features a lot better actually. So I'm excited about it for First 5 anyway. So.
Oh, good. Good.
Yeah.
I know I've done a few site visits over the past month or so, and what I've been telling those sites is that, just be patient with us, bear with us. It's going to be kind of a roller coaster over the next, month or so still. And we apologize for any guidance we're giving that's not consistent, but we're hoping over time it will become, excuse me, a very useful system, and we'll have that user guide more updated that correctly reflects everything that we're wishing and hoping for.
I'm curious on how like the exporting, like the data to pull, numbers and things like that for reporting. I'm excited about that feature. So yeah.
I think that should be nice too. A little bit easier than when we did data pulls from CARES.
Right.
And more reliable too.
Yep.
Do we have a timeline as to when the reporting feature will roll out?
That's a good question. I don't know. Does anybody, maybe somebody else on the call knows? There have been quite a few TAV meetings, so it might have been said. Does anybody know? I'll write that down and I'll check on that.
And then I don't think like the exporting is, there's just like a basic how to, there's nothing specific to first 5 like steps to do that. That what I can see anyways, the last time I reviewed, is that something that could be added to the first 5 manual?
We can talk about that. Michelle and I are meeting with April this week, and we will ask about making that more specific to first 5, and either maybe part of the manual or something separate.
Yeah, that'd be great. Thank you.
Yep.
This is Veronica, and I like that all the families, you can get them all linked together so then you kind of know who you're serving, especially if you go in there later on and see, how many siblings a child has versus trying to ask the family that. And I also like, oh my goodness, I just lost my train of thought. Well, I'll say it later if I remember.
Sounds good. Thanks, Veronica.
Yeah.
Rebecca, this is Megan from First 5. I do have an additional question for all the first 5.
Go ahead.
Okay. For the first 5 episodes that were transferred from CARES into TAV,
Wait, can you start over? I already lost you. I was talking. I'm sorry.
Okay. When the episodes were transferred from CARES into TAV, it opened the first 5 episode date. It kind of chose like a random date that wasn't necessarily our referral date. Okay. If it was a client that we had worked with in the past and had previously closed like their first 5 TAV and CARES, they still have an open first 5 episode in TAV. Do we need to be closing those episodes as we come across them?
So they're episodes that are unnecessarily open from the migration. Is that what you're saying?
Yeah. Yeah.
That would be, yes, I would close those. You don't want them to keep popping up through your activities. And then I'll give that feedback to April. I think somebody else told me that as well. And if the incorrect referral date is in there and it is a client you're working with, if you can fix it or if you know when that date was, I would definitely advise changing it to the accurate referral date.
Okay. And when we close them out, there's no place to do like a closing date, like when we close that episode? Is that something that we can get added, or there is a comment section? So I have just been putting in the comment date that it was closed.
I'll write that down. But yeah, I think that's for now a good solution is just to document things in notes.
Okay.
So yeah, no, I have it down to look into adding a close date in the episode.
Perfect. Thank you.
And hopefully we're still kind of finalizing the consortium agenda, but I'm sure there will be some TAV component. So that way that'll give us an opportunity to follow up on a lot more of these things in person. So look forward to that in the next, I guess at the end of the month. All right. Anything else from anybody? I have a lot of good things I need to follow up on, so thanks for all your feedback. And if you've emailed the question and we didn't get to it, I do have all the questions. So I apologize if I didn't get to it. I know I got Amber sent me a list of some things, so I will be in touch with you if I didn't answer your question.
Rebecca, wait, I'll send you a revised version. We're going to go through and see what we can knock out of that after our conversation today.
Okay.
So don't even look at it until we get.
Okay. We will wait on that. All right. So I think we will close out from discussing TAV. But thanks for everything, and feel free to keep emailing us and letting us know as issues arise, or positive things too are always good. So I'm going to turn it over to Melissa. She has an announcement to make for everybody, so I will turn it over to her.
Yeah, can you guys hear me okay?
I can hear you.
Okay, cool. I'm just going to assume everyone else can then. I wanted to let everybody know that I have taken a position in nursing services working in the continuing education office, and I'll be leaving my role on First 5 and CHSC. My last day is this Friday. I'll be moving over to that position on Monday. I do have some deliverables for some of you that are having some events coming up. I was trying to get as many out last week as I could, but I can be in touch with anyone, and if there's anything that pops up, you know, that you need me for, I can send out my, I think my email address will stay the same, but I'm going to be at UIHC still, so I can always give a call over to Coffee or Jean. Point of contact for practice transformation, medical consultant stuff will most likely be Jean in the interim until they fill my position. So thanks for everything and the relationships, and I'm going to miss everybody. So
Thanks, Melissa. We're going to miss you too.
Thank you.
Yeah, congratulations, but I'm sad.
Thank you. I know. I'm sad too. I'm gonna miss this program, and it's near and dear to my heart. So you can bet I'm still gonna be telling people about MChats and ASQs and First 5. So. But.
All right. Well, on that sad note, but we're also happy for you too. We'll go ahead and end the call today. I have it recorded, so we'll get that shared with you as soon as it's converted. And hopefully follow up on a lot of the things that we discussed today that we didn't answer. And then, like I mentioned, we may have a discussion, our next discussion on TAV at the consortium. So other than that, keep emailing your questions, and we'll talk to you soon. And Melissa, will miss you.
Thanks. I'll miss you too.
Have a good day, everybody.
Okay. Bye.
Bye.